Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
G'day and Swadikap. Well, today at the Pattaya City Expat Club, we were very blessed to have Dr Niti from Bangkok Pattaya Hospital back with us talking about the prostate again. But this was new information from when you talked to us, say, about 6 months ago. So what's the new thing?
The new thing that we talk today is we call the Urolift. It's a new operations. It's like a minimal invasive surgery for the prostate. It's quick recovery. And it's a very good outcome.
Yes, and you don't even need a general anesthetic or anything?
We can done under, we call the sedation. It means that we're giving you the medicine, make you sleep, like a deep sleep, but you can breathing by yourself. That is mean we call the deep sedation. That is can
just like relaxing and
relaxing just 20-30 minutes.
Oh wow! So it's all over from start to finish in 30 minutes.
Yes, sir.
Wow! Right. So and this is and it lasts a really long time too.
It lasts long for 5 to 10 years, but we found that 30% of the case maybe have to do the secondary surgery after 5 years, only 30%.
But 5 years for such a minimally invasive surgery, that's really amazing.
Yeah, we do that because we would like to preserve the sexual functions and no need medication after that.
Because it used to be so horrific, right? You would just...
We just use like a stent to open up the water channel for you, compress the prostate away from the channel.
So I think if you're over 50 if you're a guy over 50 or you know a guy over 50, they really want to watch this talk because it really outlines the sort of alternatives there, because there's quite a few. Because you go into a very detailed examination of the client and their history, etc., don't you?
Yeah, because we have to take a look about your history, the examinations, and another investigations to find out what is the problem that you have.
Yeah, well, hopefully, of course, it is BPH. So that, which seems, Bangkok Pattaya Hospital seems the place to go. BPH in Bangkok Pattaya Hospital and benign prostate hypertrophy. It's an amazing coincidence. But so what sort of percentages are we looking at? Say, if I'm over 50, what sort of percentages have people prostate issues?
If you're over 50 years old, you have the prostate issue maybe more than 50%, 60-year-old 60%, 70-year-old 70%. And if you're over 80 years old, more than 80%, you're going to have the prostate problem.
Wow, so you've got to address it with medication or surgery or something?
Yeah, you have to do something, medications or the surgery, but now we talk about the minimal invasive surgery is the Urolift.
It's such a big advance, such an amazing thing. And by the way, every client I've spoken to who've gone to this Dr. Niti, they just rave about how excellent and thorough and what he is. Also, the talk touched on the general question of sex drive. So how much does having the BPH affect your sex drive?
The BPH and the sex drive is the common problem when you get older. But anyway, in some case who have the prostate enlargement and you have to take the medications, it can affect your sex drive.
Right, so the wrong sort of medication for your prostate, then you lose your sex drive. Is the reverse true? If you take stuff to increase your hormone levels or your sex drive, does that then affect your prostate?
Yeah, if you increase your hormone level, your sex drive is getting better, but it can make the prostate, it gets more trouble.
You see, it's a delicate balancing act down there. There's so many different parts interacting in such a tight little area. One stage I thought I might have prostate problem, and it turned out to be this like ligament that goes along the side of the... I'd like to point it out to you, but I'd probably be justified as a porn video then. So, what led you to actually specialise in urology?
I do specialize in the minimal invasive surgery for the BPH, all of the prostate enlargement treatment, and I specialize in the men's health and also with the sexual dysfunctions, and always I do the penile implantation surgery.
Yes, this is a fascinating subject. I hope we're going to have a talk on at the club by somebody who experienced penile implantation. It's amazing. And the guy who's had it, one guy who'd had it done by this gentleman raved about how wonderful it was. So if you're living in town, Bangkok Pattaya Hospital, Dr Niti, and if you're not, definitely check out his talk because it really, really is informative and wonderful. Thank you, Dr Niti.
Thank you very much, Dr. Ren.